Well, hello everyone. Welcome back to my channel, The Health Nuggets. I have my coffee today. Let's begin. We have some important things to talk about today, and I hope you enjoy this topic and it's informative. If so, please hit the subscribe button. In this video, we dive into the wild world of myths, conspiracies, and facts that will make your brain go, wait, what? Today, we're tackling a hot topic, the anti-vaccine conspiracy theory. We'll explore its origins, the role of health organizations, and one prominent figure behind the narrative, Robert F. Kennedy Jr., or RFK. Let's get started. To kick things off, let's talk about the Health and Human Services Department, or HHS, the ultimate boss of health and welfare programs in the U.S. If healthcare were a rock band, the HHS would be the lead singer. Yep, the 47th president has nominated RFK Jr. for the HHS secretary position. Hence this topic. We're going to talk about the much debated and debunked anti-vaccine theory. And you might ask, why open the Pandora's box? And that's because your health matters. You may see some changes to the program under the Health and Human Services Department in the coming next 4 years. This department oversees 115 programs across various health domains. These 115 programs include healthcare access. It's programs like Medicare and Medicaid. Medicare, my parents use, and I know a couple of people that are under the Medicaid. When I was taking care of patients at the emergency room, a lot of patients were under that program. Another one, public health initiatives. It promotes disease prevention and community wellness through various community programs. And research and development. It supports biomedical research to improve health outcomes. Also, food and drug services, food and drug safety. That ensures that your food and drugs are safe for public consumption. This government agency is enormous. They manage billions of dollars to keep Americans healthy and address public health emergencies. Fun fact, the HHS budget is about $1.7 trillion. That's a trillion with a T. I bet Jeff Bezos is crying somewhere right now, but these billionaires don't have to worry about their health plan, right? They've got so much money. And also given that Elon Musk will likely be a trillionaire soon, so maybe he can give some money to the HHS. In short, HHS is the backbone of America's health infrastructure, tackling everything from health insurance to disaster preparedness. On to one of the most controversial figures in the anti-vaccine narrative, RFK Jr. He's a Kennedy, part of Americans' political royalty. Kennedy claims vaccines are causing an epidemic of chronic diseases, including autism. He's been a leading voice in the anti-vaccine movement, pushing the idea that vaccine ingredients like thimerosal are dangerous. But there's zero credible scientific evidence backing these claims. But more on that later, everyone. What makes this alarming? Well, Kennedy's influence isn't small. He really is the backbone of anti-vaccination. A 2021 study showed that just 12 individuals, including Kennedy, were responsible for nearly 65% of anti-vaccine misinformation on social media. And that's massive. And his organization, Children's Health Defense, has grown significantly, even doubling its revenue during the pandemic. And let's go back to what thimerosal is. Thimerosal sounds like something from a chemistry class you took probably in high school, right? Well, it's been around since the 1930s to keep vaccines free from bacteria and fungi contamination, particularly in multi-dose vials. And trust me, as a nurse, you'd rather have the thimerosal in your vaccine than a petri dish of nasty microbiomes. So the Kennedy and others claim thimerosal is toxic and links to autism. The truth is that mercury in thimerosal is ethyl mercury, which your body processes and expels quickly, unlike methyl mercury found in fish. That's a big difference. And as a precaution, as all these anti-vaccine stories were coming up, thimerosal was removed or reduced in nearly all childhood vaccines in the US as a precaution. Yet autism diagnoses continue to rise. And this disconnect further debunks the claim that vaccines are linked to autism. So you might wonder, well, where did this whole thimerosal autism link start? Well, enter Andrew Wakefield. In 1998, the British doctor published a study in The Lancet claiming the MMR, measles, mumps, and rubella vaccine was linked to autism. Wakefield's work became the holy grail for anti-vaxxers, including RFK Jr. Now, here's a bit of a twist, though. The study that Wakefield did was based on a whopping 12 children. 12. And that's really not a sample size. It's more of a dinner group, right? And he did have undeclared conflicts of interest. Turns out Wakefield was being paid by lawyers suing vaccine manufacturers. Wakefield's study has been since retracted, as shown on the screen. And he lost his medical license, yet, the damage has already been done. For example, in 2023, a survey found that 1 in 4 Americans still believe in some form of vaccine autism link, showing how really misinformation can proliferate and never end. One of the other things to look at is Wakefield's research was published in a very well-known journal called Lancet, and it's well read by many researchers, academic institutions. Because this research article was published in Lancet, if the article was published in a not well-known journal, we might not have gotten this spread of information about this research than we did. The research world, which I think is pretty much an industry because we are churning out research, those research outcomes have a very huge impact on our health, also health policies. So let's not talk about the takedown. Multiple studies involving hundreds of thousands of participants have found zero link between vaccines, thimerosal, and autism. Heavy hitters like CDC, World Health Organization, even the Institute of Medicine have debunked this myth. And here's a stat for you as well. A 2014 meta-analysis reviewed over 1.2 million children and found no connection between vaccines and autism. That's science dropping the mic because we're looking at 1.2 million versus 12 children. Similarly, the CDC's Vaccine Safety Data Link monitors millions of patients annually, providing real-time safety data. And no, it's not a secret spy organization, but it's a game changer when it comes to keeping vaccines safe and effective. And isn't that the goal for developing these vaccines? So what's the Vaccine Safety Data Link? Now picture this, a giant database with information from millions of people enrolled in different health plans across the US. Think of it as a supermart vaccine library or log that tracks how vaccines perform in real life, not just in lab. And the Vaccine Safety Data Link isn't just sitting there collecting dust. No, it's working overtime, giving us insights into vaccine safety and its effectiveness. So let's break down its superpowers. First, rapid cycle analysis. Well, that sounds fancy, right? But basically this means the system can quickly detect any potential side effects soon after vaccines are given. It's like having a smoke alarm for vaccine safety. If something's off, we'll know ASAP. Next, collaborative efforts. The Vaccine Safety Data Link doesn't work alone. It teams up with major healthcare organizations across the US. It's like the Avengers of public health, but instead of fighting aliens, they're making sure that our vaccines are top-notch. So why should you care about this? Because the vaccine safety data link makes sure vaccines are not only protecting us, but doing it safely. It's the behind the scenes hero that keeps us all healthy without us even realizing it. The vaccine safety data link is dynamic, and data is being added to that database on an ongoing basis. Why is this important? Now, the problem is the turnaround time between a study and when it becomes published is a long time span. But with databases like this can be made quicker to the public. So that in itself, the turnaround time, it's a huge benefit in terms of getting the right health information out to the public. And I wanted to go over a study that used this database. Basically, they went back in time using medical records to study the connection between thimerosal exposure and kids' neurophysiological development. First, they dug through computerized medical records to find children with all kinds of exposure levels to thimerosal containing vaccines during pregnancy, vaccines during infancy. Then they used electronic immunization registries, medical records, personal vaccine records, and even interviewed parents to figure out how much ethyl mercury each child was exposed to. When the kids were between 7 and 10 years old, they brought into a clinical setting to complete a series of standardized neurophysiological tests. These tests included things like memory, attention, motor skills, you name it. The results of the test, as with later other studies, this study didn't find any link between autism and vaccines or thimerosal. Studies like this help us understand what's in our vaccines and make sure that they're safe for everyone. Not surprisingly, diseases like measles have surged in the areas with low vaccination rates. A 2019 measles outbreak in the US saw over 1,200 cases, primarily among unvaccinated populations. The stakes couldn't be higher. So why does Robert F. Kennedy Jr. cling to this debunked theory? Well, maybe it's a personal conviction or belief. Maybe it's a trust of big institutions. Maybe it's because controversy generates attention. And let's be real, fear sells, and Kennedy's been very good at marketing fear. His claims attract attention, funding, and followers. During the pandemic, Kennedy's social media following grew by over 50%, showcasing how crises amplify misinformation. And I'd say crisis and fear. Those of you who do believe that vaccines cause autism, I'd like to hear from you. What's your basis for your belief? Please leave a comment if you like. And before we wrap it up, let's highlight a resource that's helping keep vaccines safe. Again, the Vaccine Safety Data Link. This is a collaborative project between the CDC. It uses data from millions of patients to monitor vaccine safety in real time, and that's including children. And that's a wrap, everyone. Vaccines save lives, and science has the receipts to prove it. A lot of receipts, actually. If you found this video helpful at all, hit the like, subscribe, or even share with friends. Remember, stay curious, stay informed. Let's keep facts louder than fear. Until then, see you next time.